Hey, recovering from heart surgery can be very difficult and sometimes a very lengthy process. That's why quality follow-up care is so important.
In tonight's Check Your Health report, Mary Nichols explains how follow-up care can help patients avoid having to return to the hospital.
And we really want to decrease our readmission rate.
The most important factor when looking at quality heart care is patient outcomes.
We put together a program for our CV surgery patients over the last couple of years where we've really focused on preventing them from coming back.
One reason a heart patient may return to the hospital is something called fluid overload.
With fluid overload, it sends them into a arrhythmia, into atrial fib, which is a rapid heart rate.
To avoid that, doctors make sure patients are on appropriate medications and that fluid levels are where they should be prior to being discharged.
And we also have a cardiac rehab nurse who has done an assessment on these patients within 7 days.
The assessment detects when something's off and treat patients right away.
If we can catch things early, we can prevent them from being readmitted.
Cardiac rehab also helps patients transition from surgery back into their regular lives.
Most of the patients come 3 times a week, and then we also send them home with the home programs.
Because of their patient outcomes, Utah Valley Hospital was recently named to Truvin's Health Top 50 Cardiovascular Hospitals.
We're the only hospital in Utah that received this award. It was based on low mortality, low readmission rates, low cost, low length of stay.
Utah Valley says receiving that award is satisfying because it shows their program is working.
So we know that surgery is really hard. It's not a fun thing to go through, but it's really important to us that we do that follow-up care. That follow-up care makes a difference in better outcomes for these patients.
Mary Nichols for Check Your Health.